Alright world, it's time to talk about healthcare, because everyone keeps talking about like health insurance. Will we repeal and replace Obamacare? Will it stay intact? Hillary Clinton, who rabidly and viciously opposed sort of the Sanders-East idea of single payer, comes out and says, oh, it's a glorious day for the United States because Trump care failed. It's actually Ryan care, and she doesn't realize that she's being hoodwinked like everyone else because Ryan care was never meant to pass in its then current form anyway. I predict that Trump will fiddle around with it. He'll work with some of the center-left Democrats along with maybe like Rand Paul. He'll hammer something out. He'll let Ryan take the fall, hammer something out that works better, assuming that he continues to have any mandate to do this at all, and then healthcare will be somewhat improved. But why are we even really having this conversation about insurance? The fusion model that we've got right now is essentially the government attempting to coerce people to do business with private entities, which is something that I do not believe the government should do. If you had single payer, if you had just government insurance, single system or a tiered system, whatever you have, you could make an argument for that. I would argue against it on the basis of efficiency. I would argue against it on the basis that health insurance of that kind is not a human right. And people conflate the two when they're talking about this situation. My suggestion is banning health insurance. Maximize efficiency by maximizing competition across state lines and even across borders with drug pricing and things of that nature. Surgical, and anything that's related to medicine at all. Any physical object should be able to be imported or made domestically. Some deregulation should take effect there. Another thing that drives the cost up is that doctors and nurses alike have to carry a lot of insurance. Well, why do they have to do that? It's because of frivolous lawsuits. Now, I've had several people comment saying, oh yeah, but I got surgery this time, they left a sponge inside, it went septic, it fucked me up, and so naturally I had to sue. If there's actual malpractice, I don't think anyone denies that you should be able to be given a financial award for that because it was malpractice. We're talking, though, about frivolous lawsuits. We're talking about the side of somebody is draining the healthcare system. Let's say that their operation went off without a hitch. 6 months later, they stubbed their toe and they blame the doctor. Oh, something that they did must have made me wonky, so I stubbed my toe. I'm suing for $10 million. That sort of stuff. And it's that sort of stuff that leads doctors to need to carry that level of insurance. It's not the actual malpractice side, it's all this other stuff. If we were to increase competition at every level within the system, privatize it further, it would simply cost less. That means anyone within the middle class, probably the lower middle class, would be fully able to afford health care. They wouldn't need health insurance. For everyone else who is too poor, I'm not against the idea of limited subsidies for those individuals, at least for basic care and emergency care and things like that. No, I wouldn't take away, someone's poor, no inhaler for you, so you just choke and die on an asthma attack or something. But it would cost so much less right now in order to prop up the system as it is. The federal government is taxing people, or was until Trump got rid of this mandate, and that was sort of the silver lining to his original plan failing there with Paul Ryan. People were having to be taxed, supplying literally billions and billions of dollars just to keep the shtick going, because it's so woefully inefficient. Costs rise every year, and so we end up paying more and more. And the problem was this: I don't think Clinton or any of her fans necessarily even realize this. Clinton might, her fans don't. You do understand that Obamacare was largely written by insurance companies, by corporations, for-profit entities that now have a government guarantor on their respective monopolies, or almost monopolies, as the case may be in some states. You do realize that, right? So then why are you applauding the idea of the ACA staying intact largely as is? It's a bureaucratic nightmare that benefits private corporate entities. That's the problem. You don't even see it. It's just like with the lamestream media, with the corporate media. They say, oh, praise Rachel Maddow, praise CNN and MSNBC, praise CNBC. These are corporate entities. They're for profit. They also partner directly with this government and other governments to literally show you propaganda to get you to vote for the next proxy war, regardless of what administration is pushing it. To vote against your best interest, to vote for censorship, as they're doing online every day now. They are constantly rambling about these secret and non-existent Nazi groups online so that they can justify more censorship, so they can drive up their own viewership by suppressing online creative competitors, decentralized individuals who happen to create a great deal of content and are actually collectively outcompeting the corporate media. That's why they're doing that. It's not because they actually, oh, well, we hate those bigots. There are no bigots, number one. Number two, if they thought they could make money from those bigots, they'd be Sieg Heiling. That's the problem. With healthcare, it's the same thing. These insurance companies are corporate entities. But Obamacare has fooled people on the so-called left into believing that they're not, that they're benevolent. Yes, I'm sure that they're just in it to help people. They're not in it to profit at all. The very idea of insurance is largely a scam. The government shouldn't be forcing anybody in any way, shape, or form to purchase any style of insurance. Largely, it should be done away with. And it could be through more privatization. But if the government were to do that, they'd lose their ability to force you to pay for all sorts of licenses and services and to pay off the bureaucracy in order to keep the whole system going. It's a secretive tax system that doesn't actually make anybody safer or more healthy. People have not gotten healthier as the result of Obamacare. Costs have not been driven down. We're not spending less money because of Obamacare. We're spending more money now. Privatize the entire system. Ban insurance entirely on this token. Yeah, declare it necessary for the public health, for the public good, that insurance goes the way of the dinosaur. Because these groups are essentially simply committing usury on sick people, or people who want preventative care, or they got cancer or something. That's step number one. Step number two, privatize it all. Make it far more cheap, so that, most people will be able to afford it without a problem. Step three, implement a subsidy that'll cost maybe 5% of what we're paying right now in order to allow the poor to access healthcare. And you can also supply a subsidy for catastrophic injuries and things like that for the middle class. It's possible to pay for this if you have driven costs down. But nobody wants to drive the costs down. It's record profits for the insurance industry. People are struggling to pay that bill right now. It's not getting better. Obama did not care about you just because you happen to be downtrodden or sick or something. He doesn't give a fuck. He wanted your votes. That's why this was all talked about and implemented. And he also wanted money from the insurance companies. That's why he let them largely write the bill themselves. They give some breadcrumbs to the poor at the expense of the middle class, no less. And that's not justice either. It is not justice for Uncle Sam to come in and force the population to be charitable, screwing them over to take care of a few other people while throwing most of that money to private corporate entities. That is not charity. It is not social justice. It's not common sense. It doesn't work. And it's been not working for years now. We can look. The proof is in the pudding. Look at how it operates. It barely does. It barely functions. That's my suggestion. We can subsidize healthcare directly without insurance companies acting as extremely expensive middlemen. That's about all. Peace out.